Hi there, and welcome to our latest webinar for Return to Work coordinators on medications for pain management in the workplace and what you can do as Return to Work coordinators if you perceive any issues with your injured workers regarding medications they might be on. Today, I'm joined by the brilliant Dr. Jacinta Johnson. She is our Senior Medication Safety Pharmacist with Safety SA Pharmacy. And over to you, Jacinta, to have a bit of a chat to us about what this webinar is all about.
Thank you. Okay. So today, as was mentioned, we're going to start by discussing pain management in general and the role that medication plays within that pain management strategy. We're going to briefly look at the types of medications that you might see your employees using, and then we'll look at the different effects that these medications can have and the flow-on considerations for that in the workplace and what you can do if you are concerned about any of those medication-related effects. So starting with pain, I'm sure we've all experienced pain by this point in our lives to varying different degrees. But it is quite difficult to define because it is such an individualized experience. So we've got a definition for you there. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such. And I think the important point that is pointed out in this definition is around the potential tissue damage or described as such. So we now understand that pain is not directly related to the actual tissue damage that's occurring. So I bring that up just because you might have people within your workplace who appear to have relatively minor issues or minor actual sort of injuries, but they're perceiving quite a lot of pain because of that. And that's because of the broader context of their situation. So we now know that pain is actually influenced by things like whether you know what the cause of the pain is, whether we know when the pain's going to end, and also your mood and psychological state and how distressed that pain is making you. So to use an example here, if you're carrying bags, for example, you've got your shopping and you're coming in from the car and the bags are cutting into your hands and it's really painful. It's not overly distressing because you know what's causing the pain, you know when it's going to end, and it's not so stressful. So you would maybe rate that as quite a low intensity of pain. If you had that same level of input around the pain signals coming in, but you didn't know what the cause was, so you weren't carrying any bags, and all of a sudden you had that same pain sensation, and you didn't know when it was going to end or whether there was something serious going on, you would find that much more distressing, and you'd probably rate that pain much more highly. So it is very individual based on their own background and the actual context of what's happened to them to cause that pain in the first place. So I just wanted to start with that. What that does mean for us is that we can really exploit those other aspects of pain when we're trying to manage it. So medications only form one part of the pain management plan. So they address the biomedical side of things. So the physical side of what's going on can be treated with drugs to a certain degree. But we now know that when we are looking to effectively manage pain, we've got to consider the broader picture. So we need a really comprehensive approach that takes into account things like the mind and body connection. So that's around the relationships and support that people have, activity as well. So still remaining physically active in spite of the pain can actually help to improve it in the long term. And nutrition fits in there as well in terms of maintaining that whole body health to minimize the pain experience. So when we do use medications, we want to really focus on the function. So instead of actually aiming for a complete absence of pain, we try to look at how the pain might be influencing your, the patient's daily activities, their responsibilities, or the activities that they used to find joy in or that make them happy. And we try to minimize the effects that the pain has on those activities rather than trying to relieve the pain completely. So that might mean in the short term when there is tissue damage issue, so an injury, that we would use the medications to actually quite relieve a lot of that pain. But in the long term, pain might actually persist after that tissue damage is healed. So we know that there are some changes that happen in the nervous system that can mean that individuals continue to experience pain even after an injury is healed. And in those situations, we really need to have a look at the function because it can be unrealistic to completely eliminate the pain. And by focusing on that need to eliminate pain, you can actually end up with worse outcomes. So we really do aim to assess function and then use the medications to improve that function as best we can. So looking now at the different medications that we use for pain. And as I said earlier, most people have experienced pain to some degree, and most people have probably used some of these medications at varying times before as well. So our first go-to for managing pain, particularly pain that's only mild to moderate in nature or pain that is long-term in nature due to some sort of ongoing tissue injury, we would go for something like paracetamol or Panadol. Another option, if there is an inflammatory component to the pain, so there often is around an injury, and in those cases we would use medications that are known as anti-inflammatories. So they include things that you buy over the counter like ibuprofen, which you might know as Nurofen or Advil, diclofenac, which you might know as Voltaren, aspirin, and there are also some prescription anti-inflammatories as well, like celecoxib, which is also known as Celebrex. These medications are very effective, particularly if there is that inflammatory type of pain in the short term, but we don't use them in the long term for ongoing pain conditions because as you use them for longer periods of time, the risks and side effects associated with these medications begin to outweigh their benefits in a lot of cases. So we know these medications increase risks around bleeding or kidney health, so we try to avoid using them long term for those reasons. The next class of analgesics that we use quite a lot in pain management are the opioid analgesics. So these are all of the medications that are either derived from the opium poppy or synthetic versions to look like the compounds that we find in the opium poppy. So they include things like codeine, which you would find in Panadine Forte, oxycodone, which is also known as endone, morphine, so that's found in MS-Contin, for example, and fentanyl, which is used a lot in pain management now in the form of a patch, so the Duragesic patch. So opioid analgesics we've had around as painkillers for thousands of years, and they are the most effective painkillers that we have in that short term. So while there is that really clear tissue injury there, and we try to avoid using them on a long-term basis if we can, because they are associated with quite a range of different side effects, which we'll talk more about shortly. Next group of medications we use for pain are known as adjuvant medications. So these medications themselves are not really considered to be painkillers, but they can boost the effects of other analgesic medications, or they might modify the pain experience in some other way by maybe contributing to mood and things like that. And we'll talk more about those shortly as well. And then finally, there are some medications we use to manage specific types of pain conditions. So if, say, a patient has an issue with muscle spasms, we might use a muscle relaxant, although that's not a painkiller per se. It can help with the pain. And there are some other conditions like migraine where we'll use other drugs that work for migraine but don't work for other types of pain conditions. This image shows you some of the effects that opioids can have on the body. As you can see, these medications can affect a really large number of different body systems. So starting with the nervous system, they can cause cognitive dysfunction, and we'll talk more about that shortly because that is a really important consideration within the workplace. They can cause problems with sleep, so sleeping too much or not getting high quality sleep, or affecting sleep in other ways, and that of course can have flow-on effects for the workplace as well. Drowsiness, obviously a big consideration. Then there are other issues that you might have heard of as well around physical dependence and addiction. And I want to just spend a little bit of time talking about the difference between those two conditions, because I think they can be used interchangeably, but they are actually quite different. So dependence is when the body becomes used to having a medication there. So it's a physical thing that the patient has no control over. And if you take a medication like an opioid for a reasonable period of time, you're going to get adaptations in your body to that medication that mean you're dependent. So for those patients, if they then have to stop their opioids suddenly, they're likely to see symptoms of withdrawal. And that's just a physical, biological process that's going on, and that's unavoidable with these types of medications. Addiction, on the other hand, does involve dependence. So there will be physical adaptations in patients who do have addiction issues, but the addiction side of it is sort of the behavioural consequences or behavioural aspects that can come into it with some medications like opioids. So that's where patients might start to place more importance on finding these medications and using these medications, and sort of prioritise that over other things that they used to really enjoy or other responsibilities that they have. And it might mean that we see aberrant use or use that is different to the directions that the patient has been given from their doctor or their health professional. And that is, I guess, more concerning than dependence. So dependence we expect to be there. If things transition over to addiction, that's when we really need to intervene so that we can prevent any of those problematic issues coming up and help the patient to continue on with their recovery. There are lots of other effects of opioids listed there. Most of these are associated with the longer term use of opioids and are probably less relevant to the workplace. Some things like risk of fracture might be important if you've got a patient who's using long-term opioids and they're in a high-risk role where injury is maybe more likely. And there's another one that's not actually on there, which is risk of infection. So we now know that opioids used long-term can actually have some effects on the immune system and might predispose patients to certain infections, particularly lung infections, so things like pneumonia. And that could be important when we're thinking about workplace considerations and vaccinations and things like that as well. But that's mainly with long-term use, not with short-term use after an injury. So from here, we'll focus on the cognitive effects, so the brain effects that the opioids have, starting with cognitive dysfunction, and look at how to manage these things if they do occur in the workplace. So before we jump into those effects in more detail, I just wanted to outline a little bit more around what adjuvants are, because that's probably not something that you come across in day-to-day life. So these adjuvants I mentioned earlier are not traditionally considered painkillers, so they don't usually have a purely sort of analgesic effect on their own. And most of them were actually medications that were discovered for something else. So we originally used them either as an antidepressant or maybe as an anti-seizure medication or a medication for anxiety. And we now know after using them over time that they actually can be beneficial in patients with pain as well. So they can form part of that longer term pain management plan. So some examples there that you might have heard of might be things like NDEP, which is amitriptyline, or Lyrica, which is a medication called pregabalin. And these medications, like opioids, because they need to get into the nervous system and the brain to work, a lot of their side effects are associated with the nervous system and the brain. So most of these adjuvant drugs, not all of them, but a lot of them also have similar cognitive effects to the opioid medication. So they can also cause drowsiness or sedation. They might reduce mental alertness, cause that cognitive dysfunction that I mentioned, or they can impair coordination. But it is medication specific. So what is cognitive dysfunction? So it's often referred to just as a brain fog, and it's really a loss of some of those higher intellectual functions or an impairment of those functions. So you might see changes in thinking, difficulty remembering and reasoning, and we define it as cognitive dysfunction if those difficulties are severe enough to interfere with daily functioning, and that functioning could include their work. So what does that look like to somebody else? It might be that you notice that people have trouble with verbal recall. Simple math calculations might be a lot more difficult for that person, and they might have issues with just concentration in general. And of course, this can be really problematic if any of those skills are required in the workplace. And it's hard to think of any workplace where you wouldn't require some of those skills. But in saying that, I want to highlight that everyone is different. And as we talked about, their pain experience can be very different, even if they're suffering from the same injury. And their response to pain medication can really vary widely as well. So those cognitive effects can be very pronounced. So for some of those adjuvant medications, they can be even worse than with opioids, or they might be quite mild, or you might not see any cognitive effects at all. And there are actually some studies that show pain itself, uncontrolled pain, can cause cognitive dysfunction and can impair thinking. So for some patients, it might be that actually getting onto appropriate pain relief, which could include opioids, might actually improve their cognitive function. So it will be very individualized. And the level of cognitive impairment that is suitable for a patient to sort of persist with will depend on the patient as well. As an example, in my previous work, I had a patient who had really severe migraines. So she was very academic. She was a nurse by trade, and her migraines were so bad that she was taking opioid painkillers, and she was using Lyrica at quite a high dose to try and manage those. And it had caused a really noticeable impact on the speed of her thinking. So everything was slowed down. Having a conversation with her took a lot longer. And she was aware of this. She knew that it had affected her ability to sort of think and to process things. And she had stepped away from her work because of that. Obviously, that's not an ideal outcome, and we're trying to avoid that. But I guess in that case, it's just demonstrating that for that particular patient, she was willing to put up with those cognitive effects as a trade-off for managing her pain. So we would obviously try and manage it in an alternative way so that we wouldn't have to see that loss of employment, but it does come down to the individual and what's important for them. The other thing that's important to note is that the effects on the individual can actually vary over time. So some patients can develop tolerance, but the level of tolerance that they develop is variable in itself. So what is tolerance when we're talking about medication? So in a pharmacological sense, tolerance has pretty similar meaning to the way we use tolerance in other aspects of life. So if you think about building up a tolerance to something, that's the same as if you're taking a medication and you adapt to that, your body adapts to that medication over time. So we tend to see a reduction in the effects of a medication when that medication is used repeatedly over time. Doesn't happen for every medication, but for a lot of the medications that we use for pain, like the opioids and like the adjuvant medications that we use, often the patients will develop tolerance. Sometimes that's a good thing if it's tolerance to the side effects, so they can often diminish over time. However, it might be that they actually see a reduction in the beneficial effects of those medications too, and therefore end up increasing their doses over time, which is not what we're looking for. But tolerance is a very individual thing, and the time to develop tolerance and the degree of tolerance that someone does actually develop will vary a lot as well. So it might be that to one medication, they develop tolerance to the side effects very quickly, and to another medication, they don't develop any tolerance, and they have the same sort of degree of side effects the whole time during their treatment. So what do we do in the workplace? How do we apply this? So I think the first thing is to remember that it is a very individual thing. The effects of medication are very individual. So we would need to start by looking at whether there is any individual impairment. as I mentioned earlier, it might be that you have someone in your workplace that's taking a lot of these medications and they actually have no notable effects. It's not affecting their work in any way, which is great. That's what we're aiming for. But it might be that there is some impairment, and if you are noticing that kind of thing, it's probably best as a starting point to talk to the individual about it and ask them to reflect on how they're feeling and have they noticed the impairment. Because as we were talking about at the start of the session, managing pain is all about maximising function. So if these medications are reducing pain but having an impairment on function, and that could be function in the workplace, then it might be useful for that individual to actually take that information about what impairment of function they might be experiencing back to their doctor to discuss it, because it could be that we need to alter the medication regime or look at some other types of treatment to minimise those adverse effects of the medications so that their function is not impaired. Then we'd look at considering the individual's role. So if there is some degree of impairment, it may be okay. It might be that we can tolerate that degree of impairment depending on the task that the individual is required to perform. So looking at whether the task they're doing is safety sensitive. So anything that involves working with machinery or driving are obviously going to be higher risk in terms of safety, but also any really complex cognitive tasks, they might fall into that category as well. So it'd be looking at the role and comparing that with the degree of impairment that the individual might be experiencing. Next, you could look at whether any modification of duties is required, and that might be short-term. As we said, that tolerance can develop for a lot of people, so it might be just modifying their tasks for a short amount of time to allow them to get used to the new medication that they're taking, or it might be that the actual medications themselves are only a short-term treatment. So it might be that their treatment will change and they can go back to their regular role and duties after a short period of time. So that can be taken into account. And then finally, supporting the individual to take part in a comprehensive pain management plan. So as we looked at the beginning, the pain medication is only one part of that comprehensive plan. And there are lots of other things that the individual can be doing, whether that's psychological support, exercise therapy, lots of other non-drug treatments. And if we can support them, giving them time to go to those appointments or whatever the need might be, providing that connection for them, as we talked about, then that might actually minimise the amount of medications they need to take in the first place, which can then have a flow-on effect in improving their function within the workplace as well. And then finally, just to finish, as we did talk about when we looked at the effects of these medications, they can be subject to misuse and addiction. And sometimes these medications are diverted, so they're used by people who are not the intended patient. So storage can be important, and depending on the workplace or the treatment regime for the particular patient, they might need to take doses during the day while they're at work. So it's important to make sure that there is safe storage for such medications, because if they are taken by someone other than the person intended, can have quite serious consequences as well. So safe storage is recommended. Okay, so to summarise, medications often form an important part of the pain management plan, but they shouldn't be the whole pain management plan. There are many types of medications that we use for pain. They can include anti-inflammatory medications or simple painkillers like paracetamol, but often for more severe injuries or more complex cases, opioids and other adjuvant medications may be needed. And those medications might affect the patient or the person's cognition, and they can cause drowsiness and other effects that need to be taken into account in the workplace. The effect of the medication will differ between individuals, and that can change over time as well, as that person might develop tolerance and their medication regime might change. And in the workplace, we need to consider these medication-related effects on an individual basis, talk to the patient or the individual about any effects that are noticed, think about those effects in the context of the individual's particular role with a safety focus in mind, and then support that individual to either review their therapy or look at their comprehensive pain management plan so that we can minimise the effects of those medications on the individual's function overall. Okay, that's it for me. Thank you.